on the phone, and I'm going to defer to her so that we can. Hello, Julie. How are you?
Hello, Soni.
Yes.
How are you?
I'm fine, thank you. I want to just be sure that I'm hearing you very loud and clear. Okay. Did you hear my introduction?
Yes, I did.
Okay, thank you so much. Please, can you just give me a little bit of your perspective or your analysis of this whole, talk about vaccine or no vaccine? Please just put us through.
Well, I'm actually happy that there is a debate going on,
Yes.
rather than complete ignorance or apathy. So, what it says, the indication is that the public is engaging.
Okay.
Which is important because this is supposed to be a democracy, and so it's important that people look at these things through all sorts of lenses.
Yes.
Personal freedom, personal privacy, personal choice, as well as disease control, and so I'm actually relieved that we're having this conversation. I think it's very important that this conversation should continue. However, I'm pretty insistent that it should be authentic information driven.
I love that.
And not
authentic.
Social media, authentic information driven, and not social media, hype driven. So that for me is where I draw a line.
Okay. All right. I have Obani Akinwale. He's a journalist. He's an engineer as well. And can you give us your perspective of it, Obani? Yes, go ahead.
We would like to have a conversation around people's rights. And we want to ensure that government out there is passing out right information, and again that people's wills and freedom are never trampled upon.
Okay.
Yeah. So basically, it's just about people. It's about how make society a saner environment and ensuring that there is fairness, justice, and equity, irrespective of whatever situation we find ourselves in the country.
Okay. Barrister Jide Olug.
Yeah, the whole concept of the vaccination has primary and secondary relevance.
Okay.
At the primary level, to build up immunity against the plague of the COVID-19, and at the secondary level, to try and curtail the spread.
Yes.
And like Engineer Obani mentioned, the government needs to get people buy into this, because without patriotism, it will be a very difficult agenda to drive, and again, to create an effective base of implementing the agenda. And that, if that is done, then the government would have reached out to the people, prevent further deaths and further infections, and of course, help create a healthy society. And like the wise people say, health is wealth. So we need that wealth in our nation, and I think that's a challenge right now before us.
Health is wealth. Oh God, I remember that very vividly. All right, Barrister Ben Ijewere. In fact, Barrister, let me preempt you a little bit, because you asked one question that actually affected. Okay, let me let you be the one to say it. Go ahead, please.
Well, good afternoon, everybody.
Good afternoon.
I align with what my colleague said. Yes, government has a primary duty for the protection of all its citizens. Yes. Now, where that protection is, it must also take into consideration freedoms of the people.
Okay.
But we now have a situation where we have a virus that every day you look in newspapers or look at the media, it seems to be mutating, changing character. So we don't really understand everything about it. At least the other ones they try to compare it with, malaria, cholera, we seem to have locked down the causes, effects, and how to tackle those. But this one, we haven't locked it down yet.
In fact, this one even has a historical antecedent.
Yes.
We're told that every 100 years, some kind of virus, coronavirus,
yes,
rears its head.
That's correct.
Okay. Well, Julie, are you there?
Yes.
Okay. In fact, you're sounding like you're right with us in the studio. I love that. Now, you've heard the four different of people, different voices, and let me ask you, with the historical, I don't know how much of the history of coronavirus you probably have, but as somebody who probably has managed human beings before, how different is this from the previous ones?
This is a pandemic. It started as an epidemic, which is confined to a local environment, Wuhan in China, like we were made to believe, that has gone around the world at the macro level. And that makes it pandemic. And from what we experienced, it's been a long time the world encountered a total lockdown like we had. And some have said, I think, around 1918 or thereabout or 28, some such thing happened. Yeah. We've had the bird flu, we've had other plagues visiting the world, but this time around it has come to affect the economy, affect the social life, and to demystify some countries. For example, America was rated as having a very high profile in health management, but at a point dead bodies were packed into refrigerated trucks. Very amazing. Some countries you felt would not have been affected with, dangerously affected. And Nigeria, on the other side, that some even predicted was going to be hit massively by coronavirus, has enjoyed a remarkable reference of grace, in the sense that the prescribed figures did not happen. Because if we were to experience what Italy and some other countries experienced, it would have been very, very terrible. But that has also come with a challenge to ask a simple question. Are we leveraging on grace in managing our healthcare facilities, or are we building capacity to be proactive in response to this external shock that visited us?
Let me step in there. Are we leveraging on grace? Well, Nigeria is a grace-infected country. I'll come back to that. I'm not being sarcastic. But Julie, are you there?
I'm here.
Okay. Because I mixed you guys up earlier. Forgive me. So Julie, but you just heard what Barrister Ologun just said, and I also asked you a question. He has answered it. I want your own side of it as well. The historical antecedents of this kind of pandemic, and then bearing in mind, if you are a manager of men and resources, how would you have managed it, and so on and so forth. Can you give us a perspective?
Well, I worked on the COVID committee last year in Edo State, so full disclosure, I have a bit of information possibly that's not available to the general public, in the sense that communications was a huge part and remains a huge part of the approach in the state.
Yes.
The other thing, of course, is the scientific information, and this is why I was saying, as long as the information is salient and it's not just social media hype, yes, then people should make informed decisions. But the decisions, I think, must be taken in the context of what the last speaker just said, that this is a pandemic. So it's not just an individual set of choices. You've got to think of family, you've got to think of neighbors, you've got to think of co-workers or co-students, etc. You've got to think of community. So you've got to think beyond your own personal, choice and preference. You have to think on a broader scale. If it's a pandemic, then it's not just you that's at risk. It's like masking. We mask not just to protect ourselves, but as a matter of fact, we mask to help the people, to protect people around us. In other words, we've got to come into an ethos whereby we are prepared to take responsibility for one another. We've got to be prepared to be our brothers and sisters keepers. And that is how we approached it last year, and I see that it's continuing this year in Edo State at least.
Okay. Now, it dovetails into what Obani said at the beginning, people's rights. What's your reaction to what Julie just said?
I think one of the alienable rights of every individual is right of choice. somebody like me now, in my house will decide who takes vaccine or who doesn't take. Okay. My wife has taken, but I've refused to take. So what it means is that even as a man of the house, I cannot insist on what she should do or should not do. And just like he said should be based on scientific and not based on mere information. Mm-hmm. I want to refer all of us back to December 2020 or early January. Mm-hmm. There was a press release by the Federal Minister for Health.
Okay.
And he said we are bringing in COVAX vaccine. But due to the urgency or requirement of the world, the manufacturers are not taking indemnity for such drug.
Oh, yes, I remember that.
Yeah. So what technically means is that everybody is on his own.
So cars are parked at owner's risk.
Exactly. That was what the minister said. The clips are still there online. Internet will not forget. Now, we have all come out to say that this particular brand can take care of 60%. This particular brand can take care of 70%. There is another brand that they call the Move version that they are not sure whether any of the existing vaccine will be able to take care of. Now, let's bring it home in Nigeria. If when the Prime Minister of Britain was having issue, was rushing to the clinic, he has the facility in there and what have you, are we subjecting over 200 million as what they call the millennial guinea pigs? Because what the manufacturer has told us is that if perhaps the drugs meet something in your system and there's a failure, we are not liable. Then it now comes to another question that because information is very, very key. We have a population of about 200 million. Let's say for statistics, 18 to let's say 70 is about, let's say roughly 100 million. And let's say the people below 100 million and between 1 and 10. And we have a country that has Johnson & Johnson of 176,000. A country that has the Moderna of about 346,000. And has the last one, the COVAX AstraZeneca of less than 4 million. The total population of Edo State, the last time I checked, is about 7 million. So if we want to even take it on the scale of, let's make the vaccine that everybody must take it, the vaccine is not sufficient even for a state. Here we are today, we have democratic elected leaders telling us how to worship our God. Here we are today, luckily I have lawyers sandwiching me from the left and right.
So they can protect
who will tell me whether the liberty to roll my fist does not stop at his nose. That's what my father told me. He said, the moment I'm rolling my fist and I touch his nose, I'm looking for fight. So the moment the government says they are there for my security of life and property, and they are punching me by the nose, and they told me that if I take this vaccine and it goes the other way, I am responsible. And I have a system that have less than maybe 50,000 medical personnel. I have a system that practically have no working health facilities. Where do I go? I don't even have ticket to go to Cotonou or Ghana. So you ask these questions that what information else do we, our government or the handlers of government or the advisor needs again to know that we should reflect back to what happened in Kano in 1996 during the meningitis. So if after 4 years, because by science they said you are trying to do RNA, you are modifying DNA and what have you, and tomorrow somebody now bring about a child that has the bottom on the head, we'll start asking questions. That is the wonder of the world. They told us you are going to be liable for anything that happens, and yet our government, our system is asking us to do. That is one. Two, we have a NAFDAC that what the judge said, we have stamped it, and the manufacturer said, whatever happens to you after this vaccine, it is your own case. So what information do we need again? So should we continue to now be chasing the Pfizers of like 1996 to be asking for compensations? Or is everybody able to attend the A-class private hospitals in Lagos? Is our political appointees, our big boys in society, are they patronizing the same PhD we are patronizing? Then what now comes that they said as a citizen I have right to choose what I want? Yes, it is pandemic. But as pandemic as it were, has anybody told us that these drugs are 100% efficacy and also they are liable if anything happens to anybody? And are people not dying even after being vaccinated? So these are questions that are all there, and luckily we have a doctor who could give us a scientific perspective. From a layman perspective, I think it is undemocratic for anybody to insist that before you go to worship your God, you must use. Is as saying technically a Muslim that you must Now, because we are rearing pig in our area, every Islamic person must eat pig because I am the governor or I am the president. That's exactly what we are saying to do. People should have choice.
Okay. This is hotter than July. Okay, so Ben Ijewere.
Yes, I agree with some of the things he said, but not everything. The analogy with the church or the mosque and makes a government imposing a lot of things. I take a different perspective. This is a public health matter.
Okay.
At least as of today. And like I said earlier on, because the world still does not understand how this thing is evolving and changing by the day.
Okay.
And from the records, it has taken out millions of people so far. It is a public health matter. And like my colleague said, it's a pandemic. So therefore, the only way the government can now respond is with some of these quote-unquote harsh, restrictive policies, because that's the emergency way to react until we have more scientific knowledge as to whether our ears are going to start growing or our toes will start growing or our noses will get bigger after the vaccination. We don't have those records yet. But he cannot just fold his hands and say, oh, by choice. He must do something to push people to go and take it. And that's what he's done. Now, those that challenged it in court, yes, fine. It's good. We need some legal pronunciations on these kind of things. Because that was how, historically, famous cases in the U.S. like the Roe versus Wade, the Brown versus Board of Education, that changed the educational system and changed the abortion rights, came about. So the court case is healthy. I like it. Let us get a pronunciation so we don't have a repeat of, like my brother said, the Pfizer, the Kano meningitis thing, and this one. So let's see if the court will give some guidelines on how you can implement these things at the same time without restricting or affecting people's free rights of choice.
Okay. Now, I'm going to, Mr. Logo, please, I need to bring Julie back for the way these two people have tackled this matter, because it's based on what she said. Julie, hello? Okay. You heard what Obani said, and also the reaction of Ben Ijewere. May I ask you, looking at the scenarios that are really presenting themselves, what kind of role would you think, if you were in a position like that, would you play?
Well, I mean, I'm a very pragmatic person, and it seems to me, statistically at least so far, that you're more likely to die from COVID than from the vaccination against COVID, right? So, I mean, that's fact number one so far. I don't think anybody's disputing that. Look, this is one of very few defenses that we have against this communicable disease, highly communicable disease. We don't know enough about it. Therefore, obviously, we don't know enough about how to defend ourselves against it. But it seems to me that the little we do know, we should avail ourselves of it, take advantage of it, use the benefits of that.
Okay.
So hand washing, for example. I mean, I remember last year we talked about hand washing. And it occurred to us that the average Nigerian washes hands into a bowl, not under running water, for two reasons. Tradition. Somebody holds the bowl for you. You're a big man or a big woman, whatever it is. But the other reason, of course, there's very little running water. Okay? So whatever it is that we've tried to devise to protect ourselves, and I use ourselves in plural deliberately, because it's not just about me, it's not just about you. And again, full disclosure, I've had COVID, and I was hospitalized for 6 weeks and almost died. So as soon as the vaccine was available, guess who was front of the queue? Me, right? I do not want to walk that road again. This thing is not a joke, right? I mean, if there's any way we can defend ourselves against this contagion, I think we should take it. But if you choose not to, then you're taking responsibility not just for yourself, but for other people, for community. In which case, government has to step in to say lockdown, or don't go to public places unless you can show that you've taken the vaccine or the vaccination. Right? I mean, there are very few things, frankly, that any government anywhere can do about this thing. We're all grappling for answers here, but the few answers we have
seems to me we better take optimal advantage of them.
Okay. Well, I love the four of you. You guys are approaching this common sense matter. Barrister Jide Ologun. Now, you're a lawyer, but you seem also to be a defender of the faithful, as they say. This thing they call coronavirus, and the fact that fingers are pointing at different directions. America accused China, China accused America again. So listen, it's a lab technology thing. It is not a natural virus. I don't know what legal mind you have to interpret this kind of back and forth accusations.
We call it blame game.
Blame game.
Exactly.
Okay.
And
right.
as at this moment, no country has really admitted being the fountain of coronavirus. But the fact that the whole world has been impacted, and the lessons we need to learn is to begin to evaluate countries and their responses to coronavirus. And I did a bit of research in that direction. Taiwan did very well in handling the COVID-19 because of previous experience and the fact that
the producer said we're not hearing your voice very well. Please, if you can put a little louder.
Okay.
Yes.
Let me look back that the lesson we can learn is how countries have responded to the COVID-19.
Okay.
And I said Taiwan did very well in pulling down the impact of COVID-19. Why? Because Taiwan has a high level of literacy and an excellent spirit of patriotism. So it was easy for the government to have the citizens buy into the preventive measures that were rolled out to tackle COVID-19. And Israel has done very well. What Israel did was to look at the cost of the vaccine, look at the cost of people dying and the impact on the economy to say, okay, let's be proactive. Let's pay a higher premium to prevent our people and ensure that they have health. And you talk of Vietnam, you talk about New Zealand, you talk about Thailand, you even talk about Rwanda, how these things have been managed. And you saw that at a point in time, I think Madagascar also came in this country that came up with vaccine in Africa.
Yes.
And
then the president died thereafter.
Yeah, let's bring it back to the health infrastructure.
Yes.
In the human life cycle, a child is born. The primary need at that point is health care, and you need it throughout your stay here on earth. So how have we prepared for it? And in the case of Nigeria, there is sufficient provision for the health care of the people. And I'm challenging our listeners today to please go and study Section 16 of the Nigerian Constitution 1999 as amended. It prescribes how the economy should be managed in a way that we have sustainable development, in a way that we provide maximum happiness. It's specified there to the people, care for the old, and you now go to Section 14 subsection 2 of the Nigerian Constitution 1999 as amended, that stipulates that the security and the welfare of the people shall be the primary purpose of government. And within the confines of security, health security is principal. And when you talk about welfare, like I mentioned earlier, health is wealth. The commonwealth should be for the common good. And we should have the facilities that can manage us well. And I'd like to allude to what happened in the UK. The Prime Minister of UK, Boris Johnson, was not spared by COVID-19, and he was treated right there in UK in an hospital you consider a public hospital there. But consistently, my president, whom I respect so much, and the commander-in-chief of the armed forces, who presides over the affairs of this country in the governance circle, has indulged in rushing to the UK for medical care. So I am compelled to ask a question. If my leader is not interested in developing capacity, where do we turn? And so we don't now want to ask where the masses are kept in this. And that is why it's difficult to have the buy-in of the people into the policies. So when the people know you care for them, I just gave the example of Taiwan, they will follow you. And that is where we are right now. Do we even primarily have the attitude that people deserve the best? Whether you are talking about how the palliatives were managed, whether you are talking about the promises that were made to even, the stimulus in handling the economic situation. So countries of the world are
are exposed to different kinds of shocks. There are valleys and mountains in life. So let's bring it to the health sector. Like I just said now, what have we discovered in this country? That even as we are talking about vaccination, which is just a tiny aspect of the healthcare value chain, resident doctors are on strike now. And we are not so bothered that Saudi Arabia is even coming on our own land to recruit them. And if we prevent them from carrying out that recruitment, our own doctors will pay for their visa, for their tickets to go over there to seek a greener pasture. And I say today that the greenest pasture on earth by God's resources is Nigeria. But have we maximized the resources? And these are the big questions looking forward. So what lessons can we learn from here? What lessons? Someone wants
hold that question. Hold it. I want, because we're entering the phone call segment, but I want Obani, Ben, and Julie to, in fact, you don't cause katakata. Obani, what do you have to say now? The man has.
I think I will start from where the doctor stopped.
Yeah, but I'm going to give you one minute.
Okay. And phone calls. And the question I want to ask is, she said we should not. We are used to washing our hands in the bucket, in the bowl. The question is that how many?
I think that was Julie.
That was the doctor. That's what I'm talking about.
Okay,
yeah. Julie.
Okay, yes.
What I want to ask is that how many households in Nigeria has running water pipe? So if we cannot provide as small as a working or running water system that will allow people to wash. Have you gone to Lagos school recently? You will see bucket by the entrance. You will see tap attached to the bucket. You will see them filling it. That is the kind of situation we have.
Where, please?
Schools.
Public schools. Do you know why I asked that question? Yes, public schools. There's a video flying around in university, I think in Suka.
Yeah.
Oh yeah. You know, the bathrooms and everywhere was so. Okay.
So the question is, if as small as providing running pipe borne water, there is no single state in this country today, I stand to be corrected, that can say they have up to 40% coverage to supply water, and we are not a landlocked country.
1 minute is almost up.
So the fact is there. Cholera we have been able to tackle.
You don't come back.
Yellow fever we are able to tackle.
Cholera has come back.
Polio we are able to tackle. That is the 1990 diseases. Now we are talking about 21st century ordinary wash and water, and we are saying security of life and property, primary health care. We have internet facility to register for COVID, but people cannot vote on internet. There's a lot of the things that we need to look at when we look at our health. We mentioned the doctors now. Which way do we start from?